Our next speaker requires no introduction. He is one of the pioneers, one of the, I would not be wrong if in Hindi I say the Janam Data of corticobasal implantology in this part of the world. He is none other than our very renowned, very respectable Dr. Prashant Pillai sir. Dr. Prashant Pillai sir is into corticobasal implantology for over 10 years now. And he has vast experience. He is an oral and maxillofacial surgeon by his educational qualification, practices in Kochi, and requires just no introduction. I would not be wrong if I say he's Amitabh Bachchan of our fraternity. So without much ado, Dr. Prashant Pillai sir will be speaking on immediate loading, relevant history which every implantologist should and must know. Thank you very much, sir. The stage is yours.
Good morning. I wish you all a good morning. Thank you. Okay. So, immediate loading, relevant history which every implantologist should know. I thought it's a very important topic which all of you should be aware of before you, seriously start practicing implantology. A careful analysis and understanding of the roots of our history ensures a thorough and thoughtful application of our technology in the future. So said Dr. Linkow in 2007. So history of any science really plays a very important role in ensuring that it progresses in the right direction, and it will also give us insights into how it can evolve beyond a certain point to reach its perfection. So that's Professor Linkow. There has been a need to replace missing or broken teeth since mankind existed. We owe today's dental implant advances to our ancestors who tried everything from precious stones to teeth from dead bodies in pursuit of the perfect dental replacement, making dental implant history so fascinating. So we come to the pre-Columbian era. There are very well-known descriptions of archaeological findings from the pre-Columbian era of 7000 BC, exhibiting stone inlays in teeth or even used to replace missing dental elements. And in 2500 BC, ancient Egyptians used gold wire ligatures to help stabilize damaged or loose teeth. 600 BC, the Mayans, they were the masters of cosmetic dentistry. They used to decorate teeth with precious stones, knowing exactly where to drill without hitting the pulp. They were also skilled in inlaying very well-carved stones in meticulously prepared cavities on the labial surface of the front teeth and sometimes in premolars. These inlays, which served a purely aesthetic purpose, were made of a great variety of rounded minerals of different colors, such as turquoise, quartz, serpentine, and cinnabar. In 500 BC, the Etruscans, who were living in the now modern Italy, were the first to use dental appliances, bridges, and retention bands they replaced missing teeth with artificial teeth carved from bones of oxen. The upper front teeth of a Maya individual, this photograph depicts that from the 8th century AD. The carved stones were then set in these cavities, fitting them so perfectly that many have remained in place for thousands of years. The ancient oral surgeons would spin a round, hard tube similar in shape to a drinking straw, originally made of jade and later of copper, between their hands or using a bow drill, applying a slurry of powdered quartz and water as an abrasive to cut a perfectly round hole in the enamel and dentine. So this is the great-great-grandfather of our aorta, which was invented by the Mayans, in Central America. And anesthesia via the hallucinogenic and anesthetizing properties of coca leaves and certain type of mushrooms. That was what was being employed. And drilling of the sockets for the old implants was with manual bow drills